Hello, friends out there. Come with me while we talk about the comprehensive overview of various sexual complications. While sex can offer numerous benefits, it can also come with various complications. And when we're talking about these complications, they can be physical, psychological, emotional, relational, and social. So let's dive into a comprehensive overview of potential sexual complication or sex, complications, various complications that are associated with sex. Number one, health complication is physical health complications. And on these days, we want to talk about the sexually transmitted infection, STIs. And when we're talking about sex can transmit infections such as chlamydia, HIV/AIDS, herpes, gonorrhea, syphilis, human papillomavirus, unintended pregnancy, unprotected sex can of course lead to unintended pregnancy or unwanted pregnancy. And that can have significant impact or personal and social implication on on individual lives. And of course, we have implications like injury, which can be physical injury, which can occur during sex, which can be anal fistures, it can be vaginal tears, it can be trauma to genital or surrounding area, depending on the type of sex that someone has. And of course, we have something we call the urinary tract infection, the tube, like a tube that carries urine can be infected in the course of sex, and it can increase sexual activity can increase the risk of urinary tract infection, especially in women. And of course, we have allergic reactions. And when we're talking about allergic reaction, can be to latex condom. Like me, I react to condoms. And of course, some people can react to lubricant or other sexual heat, which can result in discomfort or severe allergic reactions. You understand? And of course, one of the complications can be erectile dysfunction, where a man finds it difficult to achieve an erection, or when they are able to achieve, they cannot maintain an erection. And of course, this can be caused by both physical or psychological or medication. It can be medication related factors. You understand? Then when we're talking about complication of sex, we have emotional and psychological complications. Number one is performance. If you are not able to perform when we have sex, there is a problem. Anxiety, worrying about sexual performance can lead to anxiety. And when it leads to anxiety, of course, it can lead to reduction in the enjoyment of sex. And of course, this can, of course, lead to erectile dysfunction or inability to achieve orgasm. And the ultimate that we are after when it comes to sex and sexual relation is orgasm. It's very, very vital for both men and women. And of course, somebody can come down with guilt and shame. We can come down with cultural problems, religious problem, or personal belief, which can lead you to feeling of shame or guilt associated with sexual activity, maybe because of the kind of position or the kind of sex you wish to have as an individual. There can be body image issues. You understand? When you are not too fantastic, you're not feeling your body is fantastic, that is good. Then, if you continually have negative, you have negative concerns continuously about your physical appearance, it can negatively impact your self-esteem. And if your self-esteem is affected, sometimes it can lead to sexual loss of sexual satisfaction. And of course, there are mental health disorders like depression, and of course, anxiety and other mental health issues. And if it is not properly cared for or looked into, it can be aggravated by sexual problem. And of course, it can affect sexual desire, and ultimately the performances. Then, of course, we have the relational conflict and complications, and that one includes infidelity. And infidelity can be extramarital or extra relational sexual activity. And when that comes in, we begin to have trust issues, jealousy, and if it is not properly being managed, it can lead to dissolution of such relationship. And of course, there's something we call mismatched libido. When the libido of a partner is far, far higher than the other, differences in the sexual desire between partner, it can of course lead to tension and dissatisfaction in a relationship. Then there's something we call communication, which is very, very important. If you are going into any relationship, your communication should be number one. If there's communication issue, you have difficulty discussing your sexual need, your boundaries, your preferences, it can lead to misunderstanding and unresolved conflict. And of course, if somebody have sexual dysfunction issue, such as premature ejaculation, such as an orgasmia, when somebody is not reaching orgasm, or lack of sexual desire, of course, low libido, low sex drive can lead to strain in relationship. Then, of course, when we're talking about that, social complications is one of the complications, which includes stigma and discrimination. An individual may face social stigma or discrimination based on their sexual orientation, one, sexual preferences, or sexual behavior. Then reputation can be damaged as a result of sexual activities, especially if those consider socially or culturally taboo. You understand? In some culture, there's some sex styles that are seen as taboo. If you are being caught in such an act, they believe your reputation has been damaged if it becomes public knowledge. Then, of course, legal issues. Certain behaviors can have legal ramifications, such as when we're talking about statutory rape, non-consensual, when somebody has not given consent, consensual act, or public indecency is one of the complications. Then, of course, we have the ethical and the moral complication, like the one we said before, like the consent issue, ensuring that all sexual activity is consensual. The consent should be one, because it should be number one before anything. It is very crucial before sex. Non-consensual sex can be termed to be sexual assault or rape, and I want you to know it's a very severe violation of right, and of course can have devastating effect on both the victim and you the accused or the abuser. Then exploitation and coercion and power imbalances. When you see like the way they objectify women and they use women for various sexual gains, it can lead to problem where individuals feel coerced or exploited into sexual contest. So it is one of it. The moral, the dilemmas, the personal, societal moral standard can create internal conflict or ethical dilemmas regarding sexual behavior. And finally, I want you to know that medical complications can be hormonal imbalances, hormonal changes, which can be due to contraceptives or other medical treatment. They might affect your sexual desire, and of course the output and the function. Chronic illnesses like terminal diseases such as cancer, diabetes, cardiovascular problem, or chronic pain, all those things, they can complicate sexual activities. And some medication side effects, like there are some hypertensive drugs that when you use them, you feel, to some men, they feel as if they are experiencing premature ejaculation or low libido or something. It can of course impact their desire, and performance and satisfaction. Conclusively, I want you to know that why sex can be a positive and enjoyable aspect of life. It is very important to be aware and address the potential complication. By doing this, we'll be able, like having open communication, being educated, and seeking knowledge, appropriate medical and psychological support when the need arises. Remember, if you find this video interesting or insightful, kindly subscribe to my channel and let me know what you feel about this topic. Comment, like, and share. Till I come your way next time, I'm your friend. That's okay. See you in the next video. Bye.